You have been told that your heart is fragile. You have been told that at your age, any procedure carries enormous risk, that the safest thing is to do nothing, to wait, to hope, to leave things exactly as they are. And so when your doctor mentions a heart procedure, your stomach tightens, your mind fills with images you do not want to see, and quietly, almost without noticing, you begin searching for reasons to say no. I want you to stop for a moment, because that fear, the fear that may be guiding your most important decisions, is very often built on information that is 30 or 40 years out of date. I am Dr. Hiroshi Nakamura, and after more than 30 years caring for older adults and their hearts, I have watched something happen again and again that troubles me more than almost anything else in my work. I have watched patients refuse procedures that would have given them years of comfortable, independent, joyful life, not because the procedure was dangerous, but because they were afraid of a version of medicine that simply no longer exists. They were not foolish. They were not careless. They were afraid, and their fear was reasonable for the world they grew up in. But the world of heart medicine has changed beneath their feet, and no one took the time to tell them. Today I want to take that time. I want to speak with you calmly and honestly about 5 heart procedures that frighten people the most, and explain why, for most people over 60, they are far safer than you have been led to believe. What most people do not realize is that heart medicine has changed more in the last 20 years than in the entire century that came before it. The image many of you carry in your mind, the chest cracked open, the long and painful months of recovery, the very real chance of never being quite the same again, that image belongs to a different era of medicine. It was true once. Your fear learned its lessons honestly. But modern cardiac care was quietly rebuilt piece by piece, specifically around the older body. The tools became smaller. The openings in the skin became tinier, sometimes no larger than the tip of a pen. The recovery became gentler, measured now in days rather than months, and yet the fear stayed frozen exactly where it was decades ago, while the medicine moved on without it. So let us walk through these 5 procedures together, slowly, one at a time, and let me show you what they truly are today. Let us begin with the first one, the cardiac catheterization. This is the procedure people imagine when they picture something terrifying being threaded toward the living heart. You hear the words tube, artery, heart, and your whole body tenses, as though something violent is about to happen. What is actually taking place is far gentler than those words suggest. A thin, soft, flexible tube, narrower than a strand of cooked spaghetti, is guided through a blood vessel, very often now through a small point in the wrist rather than the groin, and carefully moved toward the heart so that the doctor can see, with complete clarity, exactly how your blood is flowing and exactly where it may be struggling. Think of it like sending a small lighted boat down a familiar river to find the precise spot where the current slows and the channel narrows. There is usually no large cut. There is no opening of the chest. In many cases, there is not even a deep general sleep, only a gentle, relaxing medicine while you rest. Most people go home that same day or the following morning, often with nothing more than a small bandage to show for it. The reason this matters so much is simple. When fear makes you avoid this test, your doctor is left guessing about your heart instead of truly knowing it. And in heart medicine, knowing is the foundation of every safe decision that follows. The second procedure is the stent placement. Stay with me here, because this is one where the fear and the reality have drifted further apart than almost any other. A stent is a tiny mesh tube, smaller than the spring inside an ordinary pen, designed to hold open an artery that has slowly narrowed over the years. It is most often placed during that very same catheterization, through that very same small entry point, so there is no second procedure to endure. Imagine an old garden hose that has been pinched and crimped in one spot for years, slowing the water to a thin and useless trickle no matter how hard you turn the tap. The stent gently props that pinched section back open from the inside, and the full flow returns at once. What people fear most is the idea of something foreign living inside their heart for the rest of their life, a permanent intruder. What I want you to understand is what happens in the weeks that follow. The delicate lining of your own artery grows softly and naturally over that little mesh, covering it completely until your body no longer treats it as foreign at all, but simply as part of itself. For someone over 60 who has been living with chest pressure and breathlessness from a blocked artery, this small and quiet device can return their ability to walk to the corner, to climb a flight of stairs, to lift a grandchild, all without the chest ever being opened. If you have ever turned down a heart procedure out of fear, or if you are quietly carrying that fear right now as you listen to me, write the word listening in the comments below. I want to understand how many of you are holding this worry in silence because you are far from alone, and what you learn in the next few minutes may change a decision you are about to make. The third procedure is the pacemaker. The word itself sounds frightening to many people, as though it means your heart can no longer be trusted to do the one thing it has done faithfully every moment of your life. Let me tell you what is truly happening. As we grow older, the natural electrical system of the heart, the tiny internal signal that tells it precisely when to beat, can grow tired and unreliable. Sometimes the heart begins to beat too slowly, and that slowness leaves you dizzy, breathless, foggy in the mind, or fainting without warning, sometimes in dangerous places. A pacemaker is a small device about the size of a large coin, placed gently beneath the skin near the collarbone through a small incision that heals quickly. And here is what it actually does, which surprises many people. Most of the time, it does nothing at all but listen. It waits quietly. And only when your heart forgets to beat on time does it send the gentlest possible electrical reminder, far too soft for you to feel. Think of it as a quiet metronome sitting beside a musician who has played beautifully for 90 years, and now only occasionally loses the rhythm. The procedure usually takes about an hour, very often with you awake and comfortable the entire time. Many of my patients tell me afterward that the dizziness and the constant fear of collapsing, which had slowly shrunk their world down to a single safe chair in a single safe room, simply vanished and their freedom returned. The fourth procedure is the transcatheter aortic valve replacement. The name is long and intimidating, so let me make it as simple as I possibly can. One of the valves inside your heart works like a door that swings open to let blood leave with each beat and then closes again. With age, this door, the aortic valve, can stiffen and narrow until it will barely open at all. When that happens, your heart must strain harder and harder, beat after beat, hour after hour, simply to push blood through a doorway that has nearly sealed shut. This next part is important, so please stay with me. For many years, the only way to fix that failing valve was open heart surgery, and for a frail person in their 80s, that surgery was genuinely, seriously dangerous. That is the fear you may still be holding inside you, and it was once entirely justified. But today there is another way. A brand new valve can be folded down to a remarkably small size, carried up gently through a blood vessel on a thin tube, and then opened with great precision right inside the old worn-out valve, without ever opening the chest at all. It is like replacing a heavy broken door from inside the house, sliding the new one perfectly into the frame, without ever tearing down a single wall. This entire procedure was designed for exactly the older patients who were once told sadly that they were simply too old and too fragile for anything to be done. Many of them walk out of the hospital within a few days, breathing freely and deeply for the first time in years. The fifth procedure is the cardiac ablation. This one is for people whose hearts race, flutter, or beat in a chaotic and disordered way, a condition that leaves them exhausted, anxious, and frightened of the very heartbeat inside their chest. Once again, a thin catheter is guided gently to the heart, this time not to open a vessel, but to find a small patch of tissue that is sending out faulty electrical signals, like a single frayed wire somewhere in the walls, causing the lights to flicker throughout an entire house. Once that tiny troublesome area is located, it is gently and precisely calmed, and the steady, normal rhythm returns. There is no large surgery and no open chest, and most people return home quickly. Now I want you to pay close attention to something here, because it matters a great deal. That chaotic rhythm these procedures correct is itself one of the leading causes of stroke in older adults. So the fear of the procedure, when it grows large enough to make you avoid it entirely, often protects you from nothing at all while leaving a far greater danger in place. Let me tell you about a patient because numbers and explanations only reach so far. I remember a man named Walter, 74 years old, a retired engineer, careful and precise in everything he did, the kind of man who read every label twice and questioned every single recommendation doctor ever gave him. For nearly 2 years, Walter had been growing more and more short of breath. The small slope up to his mailbox, a walk he had made without thought for decades, now left him stopping halfway to rest, one hand against the fence. His own doctor examined him, listened to his heart, and found a severely narrowed aortic valve, exactly the failing door I described to you a moment ago. The doctor recommended the transcatheter valve replacement, and Walter refused. He refused firmly and completely. Years earlier, he had watched his own father endure open heart surgery, the cracked chest, the long and brutal recovery. The man who came home changed and frail. In Walter's mind, the two things were one and the same, and no one had ever sat with him long enough to explain that they were not. He told me he would rather simply take his chances and let nature decide. So he waited, and as he waited, his world grew smaller and smaller. He stopped walking to the mailbox. He stopped attending his grandson's baseball games, the ones he had never missed. He began sleeping propped upright in a chair because lying flat left him gasping. One quiet afternoon, his daughter, frightened, brought him to see me, and the three of us sat together in my office, and I explained to him, slowly and patiently, exactly what I have just explained to you. That the procedure he was so afraid of and the terrible surgery his father had endured all those years ago were not the same thing at all. That medicine had quietly changed everything while his fear had stayed perfectly still. Walter listened. He was a careful man, and careful men can change their minds when given the truth. He agreed to learn more. 3 weeks after that, new valve was opened inside his heart through a small vessel in his leg. Walter walked into my office entirely on his own, lowered himself into the chair, and said to me very quietly that he had climbed his own staircase that very morning without stopping even once. He was not made young again. He was not cured of being older. But the door inside his heart was open once more, and so just as importantly was his life. Now I want to be very clear and very honest with you, because your trust matters to me more than anything else I could say today. I am not telling you that every procedure is right for every person. I am not telling you to ignore real risks or to rush blindly into anything. Every procedure carries some risk, and your age, your other health conditions, and your own deepest wishes about your life all matter enormously and must be weighed with care. What I am telling you is something different. I am telling you that fear built on outdated information is itself a danger, a quiet and invisible one, and that it steals good years from people who could have had them simply because no one corrected what they believed. So here's what I ask of you. The next time a heart procedure is mentioned to you, do not let old fear answer the question for you before you have heard the facts. Instead, ask your doctor 4 simple questions. Ask what this procedure actually involves in medicine today, not decades ago. Ask how it truly differs from the open surgery you may be imagining. Ask what will happen to your heart, honestly, if nothing at all is done. And ask what recovery genuinely looks like for someone of your age and your health. Write these 4 questions down on a piece of paper. Bring them with you to the appointment. Any good and honest doctor will welcome every one of them and answer them gladly. The body, even a heart that has beaten faithfully for 70 or 80 years without a single day of rest, holds a remarkable and humbling capacity to recover when it is given the right help at the right time. You are not fragile beyond repair. You are not too old to live well, to walk freely, to climb your own stairs. And you are most certainly not powerless in these decisions about your own life. You simply deserve to make them guided by the truth and not by a fear that belongs to another time. If this conversation brought you some calm and some clarity today, please subscribe to this channel and leave a like so that more people who are quietly carrying this very same fear can find their way to these answers. I will keep sharing gently and honestly what I have seen in my patients across all these years so that you can make better decisions earlier and with a steady and unafraid heart. And tell me in the comments, has fear ever caused you or someone you love to delay an important decision about the heart? I read every message, and your story may give another person the courage they need.